Okay, good afternoon, everyone. My name is Claire Reedy, and I'm the Program Manager at the Health Federation of Philadelphia for the Mobilizing Action for Resilient Communities, or MARC initiative. I'm joined in the room by my colleagues Leslie Lieberman and Carolyn Smith-Brown, and we're delighted to have you all with us today for the MARC Brown Bag webinar series. Now, before we get started, I have a couple of notes. This session is being recorded and will be archived on the MARC website. At the moment, all participants are muted, so please use the questions pane on your GoToWebinar control panel to share your comments or questions, which we'll address at the end. Mobilizing Action for Resilient Communities is a learning collaborative of 14 cross-sector networks that are using the science of adverse childhood experiences to build the movement for a just, healthy, and resilient world. MARC is coordinated by the Health Federation of Philadelphia with support from the Robert Wood Johnson Foundation and the California Endowment. You can read more about the communities participating in MARC on our website, and we also post monthly to our shared learning series, in which you can read about key themes emerging across sites and get related resources. You can visit the MARC Brown Bag webpage to see the webinar lineup, access the archives, and register for upcoming sessions, including our October 5th session with Dr. Brenda Jones-Harden on evidence-based parenting interventions, and the November 8th session with Dr. Linda Chamberlain on capacitar. If you were with us for the last Brown Bag session, you've already heard me mention the special issue of Academic Pediatrics. But since it's still pretty hot off the press, I'll do a second plug. The issue is focused on adverse childhood experiences and is available in its entirety for free online. For today's Brown Bag, we have the pleasure of hearing from Dr. Howard Pinderhughes, Associate Professor and Chair of the Department of Social and Behavioral Sciences at the University of California, San Francisco. He is the author of Race in the Hood, Conflict and Violence Among Urban Youth, which examined the dynamics of racial violence in New York City. Dr. Pinderhughes has been conducting research on youth violence and violence prevention around the country since 1989. He is a lead partner with the Unity Initiative, which stands for Urban Networks to Increase Thriving Youth, a CDC-funded initiative on violence prevention in 30 of the largest cities in the United States. Dr. Pinderhughes is the author of the forthcoming book, Dealing with Danger, How Inner City Youth Cope with the Violence That Surrounds Them, which examines how urban youth experience various types of violence and the effects of trauma from exposure to interpersonal and structural violence on both these youth and their communities. In the book, he presents the groundbreaking framework on adverse community experiences and resilience to understand community trauma and inform strategies to reduce violence and increase community resilience. Thank you, Dr. Pinderhughes, for joining us today to share more about this framework. I'm going to turn the webinar over to you all now.
Thank you, Claire, for the invitation to present to the group. And I'm going to be talking about adverse community experiences and building community resiliency. This framework grew out of work that I have been doing with the Prevention Institute in Oakland, but also through several other aspects, ongoing research that I've been doing in Oakland and San Francisco and Richmond, here in the San Francisco Bay Area. My work with the Unity Initiative, Urban Networks to Increase Thriving Youth, which was a CDC-funded initiative that was coordinated and run by the Prevention Institute here in Oakland. But it also grows out of my experiences growing up in the community of Roxbury in Boston and living through the changes that we went through in that community from when I was born in 1957, when my parents first moved into Roxbury. It was a mixed race neighborhood. By 10 years later, it was exclusively black and poor, and was ripped by the riots in 1967 and 68. And this experience became some of the formative elements for my development, along with Rachel Davis here at Prevention Institute, of this adverse community experience and resiliency framework. So that gives you a sense of a little bit of the work that I've done and my life experience that's gone into the development of this framework. But a lot of it also has come out of the experiences of working with thousands of young people here in the Bay Area and across the country who have been exposed to various types of violence. And understanding as I went through this process of doing the research, like many of you, trauma became a huge, important issue that I had to address and that we had to address. And so rather than just chronicling the problems and the experiences and the ways in which the young people understood and tried to deal with and cope with the violence that's around them, it was necessary to start dealing with some understanding of trauma. And obviously the adverse childhood experiences study and framework, and then the work that has emerged as a result of that work have been important in the work that I've done in terms of doing a lot of this work. I had to confront a lot of the young people that I work with who were in stages of despair, in stages of trauma, in stages of post-traumatic stress, and really try to unpack some of the ways in which we can both understand it, but some of the ways in which we can understand how to help these young people cope and deal and heal from these experiences of exposures to violence. And one of the things that became clear was that our young people have come up with coping mechanisms for multiple loss and traumatic loss. A lot of you will recognize things like you see on the screen now. Within literally hours, these things emerged. The T-shirts are produced, the shrines go up, and our young people and our communities move through the process of grieving and trying to make sense of violent loss. Then I asked the question, how do we understand this within the context of the ACEs study? And all of you probably know the ACEs study, Adverse Childhood Experiences Study, which was a collaborative effort by the Centers of Disease Control for Preventive Medicine and the City of San Diego. And they developed these 9 adverse childhood experiences that they wanted to take a look at and see how exposures to these 9 experiences impact adults in terms of their physical and mental well-being. And keep in mind that this was done in San Diego among Kaiser enrollees. So we're talking about, for the most part, middle-class white folks. For me, in the communities that I do my work, in East and West Oakland, the Iron Triangle in Richmond, in Bayview Hunters Point and Visitation Valley, and the Western Addition in San Francisco, the question that emerged from me and with the young people that I was working with is, what happens when you have all 9 of these adverse childhood experiences on a daily basis? And the other question that emerged as I was working with communities across the country through the urban networks to increase thriving youth and the Unity Initiative, continually the question came up, what's the relationship between the exposure to ACEs and violence and symptoms of community trauma? Because we talked consistently about some of the things that were going on at a community level around community trauma. And part of the thing that emerged in conversations about healing our young people and our adults in our community was what happens when you use individual level modalities for treatment and healing of individuals and then send them back out to the communities and the structural conditions that had caused the trauma in the first place. And so within that set of questions, we started to develop these concepts of adverse community experiences. One of the core concepts that I want you to think about and perhaps adopt is the concept of synergistic trauma, because our young people and indeed our communities are subject to multiple forms of violence, and it's the synergistic combination and impact of those multiple forms of violence on the traumatic effects and on the behavior and the outcomes that individuals, families, and communities have in the most highly impacted neighborhoods. And so synergistic trauma is the combination of individual trauma from multiple and chronic and repeated exposures to violence, and the trauma of structural violence. Now, by structural violence, I mean structural violence refers to the harm that individuals, families, and communities experience from the economic and social structure, social institutions, relations of power, privilege, inequality, and inequity that may harm people and communities by preventing them from meeting their basic needs. This is really tremendously important. I'm going to read it again. Structural violence refers to harm that individuals, families, and communities experience from the economic and social structure, social institutions, relations of power, privilege, and inequality and inequity that harm people and communities by preventing them from meeting their basic needs. And this definition emerges out of some of the work that's been done on domestic violence, originally in Canada, and now it's becoming more prevalent as a concept that's being adopted in a lot of the frameworks on trauma. Now, it also emerged out of my understandings of what happened to my community in Roxbury over the 18 years that I lived there as a child. And what I've developed as a result of my work is this framework for the social production of violence in our society. Now, obviously, this is huge. It's multidimensional, multi-layered, and it's hard to read. So I'm going to break it down for you. At the top of it is the root causes: poverty, racism, oppression, inequality, sexism, power dynamics, classism, heteronormativity. And I'm sure that you all have additional root causes that you might add to this list. At the structural level, you've got economic, political, social, cultural, and social cultural factors that function through our institutions to create the conditions that result in violence and trauma. At the neighborhood level, at the environmental level, you have neighborhood effects, family factors, and peer group factors, all of which help to produce and impact violence and trauma. And finally, at the individual level, we've got psychosocial factors, emotional state, and the motivations, which combine at an individual level to produce violent behavior, violent outcomes, exposures to violence, and results in trauma. Now, take a guess at what level we focus the vast majority of our policy and our practice in terms of dealing with the issue of trauma and dealing with the issue of violence, and that would be at the individual level. We've come to understand that trauma has a profound effect and impact on individuals, and that it's necessary for us to develop modalities and approaches and strategies for dealing with individual trauma. Hence, we've developed trauma-informed care, trauma-informed pedagogy. We've now moved to trying to deal with how we incorporate trauma-informed practice in a variety of different systems and institutions that impact individuals who have trauma. And this has been a huge, huge advance. But what about the root causes? The structural violence that happens through these root causes, and that happen and is reproduced within the institutions and the systems that we have in our society. What about community trauma? By community trauma, we're not just talking about the aggregate of individuals in a neighborhood who have experienced trauma from exposures to violence. And this is what we experienced in the Unity Network as what most people meant when they said we live in a traumatized community. And it's true. We have lots of people who live in highly impacted communities who are experiencing and exposed to trauma. But there are also manifestations or symptoms of community trauma at the community level. And community trauma is the cumulative and synergistic impact of regular incidents of violence and of interpersonal violence, historical and intergenerational violence, and continual exposures to structural violence. What we did was to take this understanding and put it within a framework that was developed here at the Prevention Institute through the Thrive Initiative. And the Thrive Initiative identified 3 domains of a community that go into making a community a healthy and thriving environment. You have the people or the social cultural environment, the place or the physical built environment, and you have the structure of equitable opportunity or economic and educational opportunity. So in terms of those domains, at the community level, we're talking about the built environment, the social environment, and the structure of educational opportunity. In terms of the place or the built environment, what we've seen, what I saw from growing up in Roxbury, from the period of time when I moved there in '57 to the time I moved out of there in 1990, deteriorated environments and unhealthy, often dangerous public spaces with a crumbling built environment. And so you have housing that starts to approximate prisons. In terms of the economic educational environment, you have intergenerational poverty, you've got long-term unemployment, you've got relocations of businesses, and you have limited employment opportunities and government and private disinvestment. This is a playground. Take a guess where they think the young people who are playing in this playground are going to end up. This is an example of how built environment comes together with some of the social norms and the social expectations. So, in the social cultural environment, it results in damaged and fragmented or disrupted social relations, social networks, and infrastructures of social support. Low sense of collective political and social efficacy, and the elevation of destructive social norms promoting violence and unhealthy behaviors over affirming community-oriented positive social norms. What now? Our slides.
Oh, there we go.
There we go.
They're working.
So part of what that means is that a narrative gets developed within communities which provides a reinforcement of the perspectives, both from the outside of the dangers and the elements of violence in the community, but also from the inside. This is an article that was written about East Oakland, life in the killing zone. And this is not only a perception that was held about deep East Oakland from the outside, but it also became something that impacted the expectations, the understandings, the constructions of the community by children, by youth, and by adults in the community. And you add to that the ever-present evidence of the violence that's happening within your community, and it has a profound impact on the ways in which people conceive of, think about, and feel about their communities. So the question is, what happens when these factors of the built environment, the structure of opportunities, the social organization, networks, and relations and norms in a community, what happens when those go from being the fabric and foundation of resiliency in a healthy community, the foundation for resiliency for people, young people and youth who are subjected to ACEs and subjected to community violence? What happens when these themselves are traumatized? What happens when your neighborhood is part of what is producing trauma, inflicting trauma, and helping to both shorten your life and, in fact, kill you? So what we've developed is a framework for preventing violence and building community resilience as a response to community trauma. Community resilience is the ability of a community to recover from and or thrive despite the prevalence of adverse conditions. In the context of community-level trauma, this means putting the conditions in place in which the community can heal from trauma and be protected against the impact of that trauma. Now, in my talks around the country, sometimes people have a question about are you just talking about making communities feel okay about the trauma that they're inflicted? And the answer is no. What we're talking about is having a realistic understanding that we are not going to end structural violence tomorrow. What we're doing in the long term is to eliminate structural violence and produce a more just and equitable society. But in the face of the current conditions, what we're talking about is helping communities to heal from trauma and be able to be resilient in the face of the current conditions. So in terms of the physical built environment, that means creating safer public spaces through improvements in the built environment by addressing parks, housing quality, schools, and transportation, and reclaiming and improving public spaces. Now, we've seen this in communities around the country that we've worked with. One example is here in San Francisco, where they have what's called trauma-informed community building, which is a model for simultaneously replacing public housing with quality housing for low-income families, with a strategy for helping to organize and recreate some of the social connections in that community so that you're healing some of the elements of community trauma. Similarly, in New Orleans, there was Taking Back Public Spaces, which in the wake of Katrina worked with community members to reimagine and think about what the community should look like in terms of its public spaces and what's the best way to utilize those public areas for community building. A Family Place library in Chester, Pennsylvania, utilizes its libraries as both a foundation for educational development and opportunity, but also a place and a space for families to come together and through that process of reconnection in a formative educational space to help change the ways families function in terms of a support system for educational achievement and opportunity. And at Pine Ridge Reservation, Stronghold Society talked with their youth about a problem they had in terms of youth suicide. And they wanted to understand from young people, what do you feel you need? And the young people said, we need a skate park. And so they said, okay, we can do that, but let's talk about how we're going to build that skate park and what it's going to be like. And they made it a community process of building, of imagining, and of developing that skate park based on Native American principles, based on cultural principles that were rooted in that community. And so as they did the process of building, and then as young people come into that space, they're engaging it through a cultural connection that's rooted in their community. And of course, when taking blighted physical areas and creating spaces like community gardens, where you simultaneously take a physical space and make it a more positive and life-affirming space, you're also changing and challenging the dietary practices and behaviors and that a community has, and injecting them with a more positive sense of how you can maintain health through your connection to that type of diet. And it has a profound effect both on how young people think about their community, but also how they think about themselves and their health. And then in terms of economic and educational environment, restorative justice, healing circles, economic empowerment and opportunity and workforce development, and strategies to increase community wealth and resources that can resist the economic pressures that result in dislocation and gentrification. Examples of this are restorative justice, or Our Joy here in Oakland, which uses restorative justice as a practice to deal with situations where problems and conflicts and even situations of crime have happened in the community. You bring people together, the people who have been impacted, both those who are the so-called victims and perpetrators, but it's a community activity and it's intergenerational. So you're restoring some of those intergenerational connections. You're changing the narrative about how young people and community folks deal with conflicts they have, and you restore the connections that people have all the time that you're healing the wounds that happen as a result of victimization. Roots of Success is an environmental literacy curriculum that's geared toward the hardest to employ and people who have barriers to employment as a result of being failed by the educational system. This is a curriculum that's used in community colleges, in high schools, but increasingly it's used in prisons for folks who have been incarcerated and are going to be released, giving them the skills and the knowledge to take jobs in the green economy. This model is one where people with life sentences are trained as master trainers, and then they are the ones who actually train the rest of their colleagues who are incarcerated and have shorter sentences. You've got Youth Build in Richmond, who's similarly working with youth around jobs in the green economy. And then you want to rebuild and revitalize social relationships, and especially intergenerational relationships, social networks, and infrastructures of social support. And you want to strengthen and elevate social norms that promote healthy behaviors and community connection and community orientation, and establish collaborations promoting these community-level strategies while rebuilding community social networks. Culturally relevant approaches to mental health are approaches that can simultaneously help young people and adults heal from the trauma that they've been exposed to, both on an individual level through the ACEs, but also on the community level through community violence. And the best case scenario is that these happen in a culturally rooted process. La Cultura Cura is a transformative health and healing philosophy which recognizes that within individual, family, and community cultural values, traditions, and indigenous practices exists the path to healthy development, restoration, and lifelong well-being. The National Compadres Network has advanced this approach as a healing modality that can help both engage young people and adults who have been traumatized, but also help to build community in traumatized communities. In the Lakota Mental Health First Aid in the Rosebud Reservation, they use Native American and Lakota practices as well as concepts as the basis for the way they structure their healing process and healing treatment. And then changing the narrative about communities and the people in it, shifting community social norms, organizing and promoting regular positive community activity, and then providing a voice and element of power for community folks around shifting and changing environmental factors as well as the structural factors. In Louisville, Kentucky, Teens in Action engaged the city council as well as the school board in terms of how to understand how to revision the school system as well as some of the approaches to youth development and youth empowerment within the city of Louisville. And then YouthSpeaks, Get Lift, and Urban Word are three spoken word organizations in the San Francisco Bay Area, Los Angeles, and New York City. And many of you, I'm sure, have spoken word organizations in your city. These are approaches that help to flip the script on how our young people see themselves and are seen by their community. If you've never been to a spoken word event, that's your homework, is to go out and attend one. You will be transformed. What you'll find is a space where young people are speaking through their pain, to speaking their truth, and getting lifted up by their community, and they're able to speak both their own truth, but also speak truth to power through their analysis and self-reflection of their own trauma and the trauma of their communities. RYSE in Richmond is an extraordinary youth organization and youth center that emerged out of a number of youth homicides that happened in Richmond, where the city of Richmond went and did talking sessions with the young people and asked what do they need, and they said they needed a youth center. They didn't just give them a space, but they gave them a transformative, revolutionary space that is youth positive, youth empowered, and youth driven, to help the young people of Richmond help to transform their community. So this is just a list of some of the approaches that I've gone through in terms of building community resilience. It's not an exhaustive list, but it is a beginning and a foundational list for trying to approach a comprehensive understanding and then a comprehensive approach and set of strategies toward building community resilience. And with that, I'll open it up to questions.
Great, thank you so much, Dr. Pinderhughes. So again, if anyone has a question or comment, please use the control panel for GoToWebinar and type them in. So the first question is about where we can find the references for some of the examples provided, specifically if they're in articles or book chapters. Is there a website where all of this is compiled?
If the slide is still up on the screen, there is contact information for the Prevention Institute. We have a website where all of the materials that have been produced through the Urban Networks to Increase Thriving Youth initiative, which is 12 years old now, and then the last 3 years of work that has produced the Adverse Community Experiences and Resilience work that we've done with Kaiser Permanente. They can all be found at that website.
Great, thank you. So the next question is, can you share more about how communities have been engaged in the process? Certainly,
and I can talk to you through the experiences we had in the Unity Initiative. We've worked with cities around the country, and initially what we did was we looked at what was the most effective ways that cities and communities could achieve reductions in violence and now reductions in trauma through collaborations. And we've seen in a number of places where it's been very, very effective. And I'll underline Minneapolis as an example, Seattle as an example, Boston is one of the communities that we've been working closely with over the last 12 years. And emerging, as I mentioned, out of that experience was the importance and the need for a concentration on the issue of trauma. And out of that, the concept of adverse community experiences emerged. Now we have an initiative called Making Connections, where we're looking specifically at some of the mental health issues that face particularly young men and boys in communities, both urban and rural, around the country, and thinking about how to achieve mental wellness within the context of community change. And so that we've been working with a range of communities around the country. That information on that initiative is available on the Prevention Institute website as well. But I will just point out that we've worked at various stages. We're in the process of working with Milwaukee around developing a comprehensive violence prevention plan that's based on this framework of adverse community experiences. So this is one of the first times where a city has said, we are going to take this framework and try to shape the work we do as a city and county in contact, in collaboration, and in coalition with the communities that are impacted and affected to try to achieve sustainable change at the community level.
Thank you. So to piggyback on that first question around involving the community, the second question is around how to engage city government to support these efforts.
That's a huge, huge question. And what I would say is that it certainly differs from city to city. What we have found is that the cities who have had the most impact and the most effectiveness and the most success in terms of reducing levels of violence and dealing with some of the issues of trauma are the ones who have had very strong leadership at the mayoral level to move these initiatives as a priority for that city. And so in the absence of that, it's important to find who are the champions in the level of the politicians as well as the folks who are in the city and county governmental structures who can champion some of these strategies and perspectives. I would encourage any of the communities around the country, if you want to understand how some of the cities that I talked about have been successful. Again, you can check out the Prevention Institute website. We have what's called a roadmap, Unity Roadmap, which is a blueprint for what's important and necessary for communities to be able to put together effective collaborations and coalitions to reduce violence and reduce trauma at the community level. And if you have questions about that, you should feel free to contact the Prevention Institute and ask about any particular issues that you might have, and whether or not there are additional materials to help communities that are trying to figure out how to negotiate that roadmap to achieve the goal of reducing violence and reducing trauma and increasing community resilience.
Okay, I'm going to combine two questions because they both have to do with funding. So the first is, do you have any advice on how to translate community trauma and resilience in a way that will resonate with funders? And the second part being, what are some potential sources of funding that might support this type of intervention?
That's all of ours question, isn't it? You know, if you'd asked me this question a year ago, obviously I'd have had a different answer. At this particular stage, what we are seeing in terms of the landscape of philanthropists differs from location to location in terms of what their focus and priorities are. What I can tell you is that there has been a sea shift in terms of how the issue of violence is thought about and addressed from a funding perspective, because of the advancement and penetration of the ACEs framework, the Adverse Childhood Experiences framework, which has shifted and changed the way in which we think about youth and even adults who are engaged in violence. Shifted it from a question of what's wrong with these young people to what happened to these young people. And similarly, this framework on adverse community experiences is starting to have that impact at a community level. So in terms of funders, one of the core questions is, what is the entry point in terms of any of these areas of community level symptoms of trauma? Because in a lot of cities and counties and states, housing has become a huge key issue. I know that's the situation here in the Bay Area, where a lot of the most highly impacted communities are being displaced, and they're getting moved out of San Francisco and now Oakland, and many of these families are ending up in Richmond, even further to Vallejo and Stockton, to places where the infrastructure is not nearly as developed, and in some cases you could call it a services desert. Being able to have that conversation at a state level to try to inform the way in which states do policy around planning, around practice. I mean, increasingly we have to get more aware and more savvy about how we deal with the different elements of it to weave together a more comprehensive approach. We're not at this stage of the politics, particularly in our national politics, going to have government that's going to embrace and fund a wholly holistic, comprehensive approach to the problem. But we are seeing concentrations on some of the different areas and elements of community trauma, and therefore community healing and resilience, that we can look at and build on and use strategies in those areas. And then when you start to do that, then what's important and what hopefully you got out of this presentation is that you take the strategies that you deal with for one area and you stretch them to be more comprehensive. So, for example, you saw bridge housing. Basically, what they're tasked to do is to do replacement of public housing. Then the question became, well, the way in which we do it basically displaces people, and we're gentrifying. It's a gentrifying force. So how do we prevent that? They answered that question by doing trauma-informed community building, which was linked with rotational replacement. So you're not displacing people, but also you're building intergenerational networks, you're building certain connections, you're building feelings of safety, you're building social connections. So integrating the strategies you have that might be funded through a housing initiative or a workforce initiative or a social service initiative, and weaving them together in ways that help to simultaneously build community and community resilience and reestablish them as the foundations of resilience while you're helping and healing individuals.
Dr. Pinderhughes, we had many more questions, which we've run out of time for. So clearly there was a lot of interest in this topic. So I really want to thank you for sharing the Adverse Community Experiences and Resilience Framework. And there were a lot of links that we sent out in the chat box. So if anyone has any remaining questions, they can email me at mark@healthfederation.org. Dr. Pinderhughes, thank you so much again for joining us today, and I hope you have a great rest of your day.
Well, thank you for having me. I appreciate it.
Take care. Bye.
Bye-bye.